I've consulted with the executive director, and I think we've decided that the way we'll run for the rest of the day is we will go through item D under number 3, which is the research report. Very much looking forward to that, Dr. Johnson and Samantha. We will then continue on the agenda through the executive director's, or the approval of minutes, the executive director's report, and the enforcement action. We will adjourn after that, and then tomorrow will be pretty much all about licensing. I'm very confident that we've made a lot of progress today. I'm very confident that we can get through all the licensing tomorrow. That's the only thing on the agenda. So my guess is we probably have another hour to hour and a half, and then we'll adjourn after we do item 6 on the agenda. I also want to just clarify, this is my mistake, we will reconvene to discuss and vote on the regulations after the redrafting has occurred the week after next, a date to be determined, which we'll communicate as soon as we've got a time and a location locked down, but it's the week after next. My apologies for the miscommunication. Okay, Dr. Johnson. Very much looking forward to this, and once again, I will give you the honor of having the clicker.
It's always an honor. Thank you.
I think you might want to just click through. I think it's next. After you get through. Yep. Fantastic. The floor is yours.
All right, wonderful. Thank you, Chairman. So thank you, Director Collins, Chairman Hoffman, and Commissioners Flanagan, Doyle, McBride, and Title for your time and attention this afternoon, after I know it's been a long day already. We've been continuing to work towards addressing all of Chapter 55's research agenda items for 2019. Today, we are excited to present to you the first report assessing cannabis use in youth from our department, entitled Cannabis Use in Youth, Literature Review and Preliminary Data in Massachusetts. Highlighted in green here are the Chapter 55 research agenda items that this report covers. This report assessed youth patterns of use, methods of consumption, sources, and perceptions of cannabis use by using a statewide data source and supplemented by a comprehensive state of science review. For future reports, we are working to procure data that would permit us to additionally assess clinical substance use screening scores across high school students, cannabis-related disciplinary actions across high schools, and trends of youth with increased risk of substance use disorders or comorbid mental health disorders. This report is split into 2 parts. First, baseline data from the Massachusetts Youth Risk Behavioral Surveillance System, or the YRBS, spanning from 2007 to 2017 is presented. The YRBS was used to assess use rates, trends over time, and risk and protective factors. Second, Samantha will present the state of the science literature review around youth, including use, access, and perceptions. And lastly, findings from both the empirical data and the state of science were incorporated into research and policy considerations for the Commonwealth. Before we dive into the data, I want to highlight 3 considerations. The impact of adult use cannabis legalization on youth will likely be lagged. Evidence from alcohol and tobacco suggests that effects could actually be delayed 10 years or longer. This reiterates that it is important to examine factors that may precede changes to use rates or patterns, such as perceptions of harm and access to cannabis. Next, all youth will not be affected equally. Research should assess differences among youth to understand how policy impacts different cohorts, particularly those who may be at higher risk. Last, youth must be considered in context. Development occurs within multiple environmental systems that all affect behavior in varying ways. For example, future research should attempt to identify how family, peer cannabis use behaviors affect youth, and the ease of access to cannabis in a youth's household, neighborhood, and/or school system. Measures to assess the context of cannabis use, medical or recreational, types of products being used, potency of those products used, and frequency of use are all important monitors to also attract. Now let's dive into the data. So, designed to monitor risky behaviors in cross-sectional samples of youth over time, the YRBS is a school-based survey administered every other year in the Commonwealth. The YRBS uses two-stage sampling techniques to ensure random sampling of public schools and students in the Commonwealth. A limitation of the survey methodology is that it systematically excludes students who have dropped out, those who were absent the day of the survey, such as truant youth, and those attending private schools. Additionally, due to the subjective nature of any self-reported survey, students may give inaccurate answers due to recall bias or because of the sensitive nature of questions such as cannabis use. However, we expect this to stay fairly consistent year to year, which makes the survey valid for comparisons of trends. In 2017, 38% of Massachusetts youth reported lifetime cannabis use. In comparison, 56%, oops, I'm on the wrong one, sorry. So backtracking, sorry. Alcohol and cannabis use are the most widely used substances by youth. To provide context around youth cannabis use, we plot comparable alcohol use measure lines in the results presented today. Between 2007 and 2017, 42% of youth reported that they have tried or used cannabis in their lifetime, what we refer to as lifetime use, again on the next slide. In comparison, 66% of youth reported lifetime alcohol use. We see that while the percent of youth reporting alcohol use has declined between 2007 and 2017, the percent who have used cannabis has actually remained relatively stable. This decrease in alcohol use is consistent with a secular trend occurring nationally, which show decreasing rates across the country. In 2017, 38% of Massachusetts youth reported lifetime cannabis use. In comparison, 56% of youth reported lifetime alcohol use. The percentage of youth who report lifetime cannabis use remained fairly stable, with a slight downward trend from 2011 to 2017, while the percent reporting alcohol use has been decreasing at a much faster pace. In 2017, 24% of Massachusetts youth reported using cannabis in the past 30 days, so current use. In comparison, 32% of youth reported using alcohol in the past 30 days. As we can see, the gap in youth reporting alcohol use and those reporting cannabis use has been decreasing over time, from a 22 difference in 2007 to only a 7% difference in 2017. In 2017, 5.6% of Massachusetts youth reported using cannabis 20 or more times, what we consider heavy use, in the past 30 days. In comparison, 15.9% of youth reported heavy alcohol use, and this is defined as actually binge drinking in the past 30 days. Between 2007 and 2011, heavy cannabis use trended upward, followed by a downward trend from 2011 to 2017, while heavy alcohol use or binge drinking in the past 30 days has consistently declined. Fewer youth in grades 9 or 10 report lifetime cannabis use compared to youth in grades 11 or 12, as expected. This trend is consistent across time and is similarly seen in youth who report lifetime alcohol use. The percent of Massachusetts ninth graders who report lifetime cannabis use has decreased from 2011 to 2017. However, other grades do not show clear trends. Meanwhile, lifetime alcohol use trended downward from 2007 to 2017 across youth in all grades. Historically, a greater percentage of males have reported lifetime cannabis use compared to their female counterparts. So this graph illuminates an important trend to monitor, as well as an important point for prevention and education. From 2011 to 2017, male lifetime use trended downward, while female lifetime use trended upward. And in 2017, the gender gap in lifetime cannabis use closed altogether, with 38.4% of females reporting slightly higher lifetime use compared to their male counterparts at 37.5%. More than double the percentage of males than females reported heavy cannabis use between 2007 and 2017. Again, heavy cannabis use refers to youth reporting 20 or more times in the past 30 days. Both genders actually show slight downward trends from 2011 to 2017, however. This graph shows lifetime cannabis use stratified by race and ethnicity. Please note that the only findings presented today are white, Black, Hispanic, and Asian students, as sample sizes were too low for American Indian, Alaska Natives, and Native Hawaiian Pacific Islanders. Overall, the highest rates of youth reporting lifetime cannabis use has vacillated among white, Black, and Hispanic cohorts between 2007 and 2017. However, since 2013, Hispanic youth have consistently reported the highest rates of lifetime cannabis use, and Asian youth consistently report the lowest rates of cannabis use in the comparison to all other cohorts presented. All racial ethnic cohorts reported less lifetime use between 2015 and 2017. However, white cohorts showed the smallest decline in use. In 2017, 42% of Hispanics, 40% of whites, 33% of Blacks, and 16% of Asian youth reported lifetime cannabis use. Overall, Black youth report the highest rate of heavy cannabis use in the past 30 days. However, the increase in heavy use among Black youth in 2011 actually returned to levels consistent with other cohorts in the following time point, thus likely overstating these aggregate cohort differences. Between 2015 and 2017, heavy cannabis use rates remained relatively stable for Black and white cohorts and decreased for Asian and Hispanic cohorts. In 2017, we saw a decrease among all cohorts, with 6.2% Hispanic, 6.1% Blacks, 5.8% whites, and 1.4% of Asians reporting heavy cannabis use in the past 30 days. Logistic regression modeling was used to examine whether cannabis policy enactment impacted youth cannabis use outcomes and associations between risk and protective factors as identified in the literature and the cannabis use outcomes assessed. Lastly, sensitivity analyses were conducted to assess whether cannabis policy enactment moderated any risk or protective effects. Results from the YRBS indicate that the enactment of cannabis policies, including decriminalization, medical cannabis, and adult use cannabis up until 2017, were not statistically associated with greater odds of youth reporting lifetime and past 30-day substance use behaviors, including cannabis use. Policy enactment analyses suggest that these policies are associated with lower odds among many lifetime and current substance use behaviors. However, since the odds are so minimal, results should not be interpreted as cannabis policies decreasing youth substance use behaviors because there may be multiple other phenomena going on simultaneously that are not adjusted for in the data models. And all results should be taken into the context of trends occurring at the national and state level, both which report a decrease in all substance use behaviors among youth. Lastly, 19 risk factors and 5 protective factors were identified. However, sensitivity analyses, this third part, showed that cannabis policy enactment only moderated one risk factor, which was driving after alcohol use. This slide shows the associations between all cannabis use measures assessed and the effects for cannabis policy enactment, which includes 3 distinct measures indicating year of enactment for decriminalization, medical cannabis, and adult use cannabis implementation. For those in the audience who haven't had a stats class in many years or somehow, and very luckily, evaded one altogether, we just wanted to give a quick memory refresher. The statistical measure of association reported in these models are odds ratios, which are followed by asterisks indicating level of statistical significance. No asterisk here indicates that the model was not significant at all. Bolded odds ratios mean that the model's result, which statistically examine the association between an independent variable, such as cannabis policy enactment, and dependent variable, such as lifetime cannabis use, was statistically significant. If the odds ratio is above 1, this indicates that the dependent variable was associated with greater odds with the independent variable. Conversely, if the odds ratio is below 1, this indicates that the dependent variable was associated with lower odds. So as you can see, no cannabis use behavior was positive and significant when testing for cannabis policy enactment for decrim, medical, or adult use, suggesting that the enactment of these 3 types of cannabis policies as of 2017 are not currently associated with increased odds of youth cannabis use in the Commonwealth. We similarly assess associations between cannabis use behaviors and other youth risk and/or protective factors. The aim of these analyses was to identify risk and protective factors associated with youth cannabis use behaviors for consideration for monitoring co-occurring behaviors and provide public health prevention opportunities. The themes of risk protective factors fall under broad categories, including disability, risky driving behaviors, weapon carrying, exposure, violence, bullying, sexual and dating violence, hopelessness and suicide behaviors, sexual behaviors and orientation, and other risk factors such as grades and extracurricular activity involvement. This table shows the results for both disability and driving behaviors. All risk factors, with the exception of having a physical disability, are associated with greater odds of the 3 cannabis use behaviors assessed. Similarly, this table shows the results for weapon carrying, exposure, violence and bullying, and sexual and dating violence. All models were positive and statistically significant, meaning all the behaviors assessed were associated with increased odds of youth reporting all 3 cannabis use behaviors. Similarly, all hopelessness and suicidality behaviors were associated with increased odds of youth reporting all 3 cannabis use behaviors assessed, from feelings of hopelessness to actually being treated for a suicide attempt. This table shows the results for sexual orientation and behaviors. As expected, most risky sexual behaviors were associated with increased odds of youth reporting cannabis use. 2 things are really important to note from this table. First, the highest odds of any behavior we assessed here that was associated with cannabis use behavior was reporting substance use before having sexual intercourse, which indicates a critical trend to continue to monitor as well as a place for intervention for cannabis use. Second, being heterosexual was actually found to be a protective factor against all 3 cannabis use behaviors, which differs from youth reporting being gay, lesbian, or bisexual, which was actually found to be a risk factor for use. Again, this all highlights an important area of potential prevention and intervention. Lastly, this table shows other potential risk and/or protective factors. Importantly, it shows that 2 factors were protective against all 3 cannabis use behaviors. Youth reporting having any adult support, whether a family member or another adult, and those reporting having higher academic grades in schools were greatly protective against all 3 cannabis use behaviors. The public health prevention model is an inclusive model targeting the overall health of the public at large, and a public health framework is one tool to understand how and where population health surveillance and measurement occurs. Since legalizing and regulating substances with a dependence potential are often in juxtaposition to public health policy approaches, since the minority of very heavy dependent users account for the majority of consumption, which generates the greatest tax revenues, careful consideration to potential public health and public safety effects are critical. If we understand how these policies affect certain vulnerable cohorts, such as youth, we can proactively implement evidence-based processes to counter any adverse outcomes. So Gosh and colleagues actually at the Colorado Department of Public Health and Environment developed a framework to specifically evaluate the potential harms and benefits to public health from cannabis legalization. We use this framework to assess what we in Massachusetts are currently doing, as well as what we could be doing to prevent youth cannabis use in the future. In this framework, policy development refers to the policies and regulations that protect and promote public health and safety. For example, in Massachusetts, policymakers ensured that there were both public health and public safety appointees. Additionally, you on the Commission implemented 11 regulatory elements for youth prevention and 7 additional elements for public health more generally, thanks to Commissioner Flanagan's guidance in identifying these regulations for us. Assurance refers to the enforcement of public health-focused regulations and workforce competency around public health. Massachusetts examples of insurance include enforcing regulations such as child-proof packaging and ensuring that cannabis products don't appeal to youth, in the Responsible Vendor Training Program, which requires education around risks to youth and diversion prevention. Assessment refers to monitoring, investigating, and education around cannabis use and the health effects of use. Massachusetts examples of assessment include the More About Marijuana public awareness campaign, which targets both a general audience and parents specifically, and the statutorily required annual research agenda, part of which seeks to monitor trends in youth cannabis use. All right, so now I'd like to transition to Samantha, who will guide us through the state of the science, research gaps, and policy considerations for the Commonwealth.
Thank you, Julie. So I'm going to cover the state of the data, or the state of the science, through presenting a series of literature reviews around youth use patterns, perceptions, and I'll stay focused at the national level. So first, I want to provide an overview of the research assessing the impact of cannabis policies on youth use. There are some mixed findings as to whether decriminalization is associated with increased youth cannabis use. A literature review of 5 high-quality studies found that the majority of these studies did not find an association between decriminalization on youth use. One study from California, however, did find decriminalization was associated with increased 12th grader use. There's more research surrounding medical cannabis legalization, and it largely does not find an impact of medical legalization on increased youth use. The research is still developing around the impact of adult use legalization. A few early studies have not found associations in increased youth use, but because of the projected lagged effects, it's really too early to assess the full impact. And there's also evidence suggesting that certain cohorts, such as youth who work, may be uniquely affected. When we looked at youth methods of use, we find that smoking cannabis flower remains the most common method of consumption. Research is just starting to develop around edible and vaping use patterns. Early studies have found youth may perceive both as healthier alternatives compared to smoking and less risky. Both consumption methods are also easier to conceal. While rates of youth vaping have drastically increased in recent years, there are gaps in the literature about vaping cannabis specifically. Monitoring the Future, a key national survey of high school students, first asked about cannabis vaping in 2017, where 9.5% of 12th graders reported vaping cannabis. And this percentage increased to 13.1% of 12th graders in 2018. In the next review, we looked at patterns in youth substance use. We find that alcohol-only use is the most frequent substance use profile among youth. And it's followed by those who report having ever used cannabis and having ever used alcohol, though not necessarily at the same time. Having ever used tobacco as well as having ever used cannabis is the next most frequent profile. Youth who report cannabis is the only substance they've ever tried is much less common. Risk factors for youth who report using cannabis and using alcohol include being male, reporting truancy, more evenings out, and reporting other substance use. We also looked at substitution and complementary effects with cannabis and alcohol. And so we looked at whether the substances are being used together or if one is replacing the other. And what we found is more research is needed, but the current research suggests both are occurring, depending on settings and groups. We found large gaps in the literature exist around cannabis and other substance use. Regarding sources of purchase, we find most youth report obtaining cannabis for free and from a friend. Youth who live in legal medical states rarely report using someone else's medical cannabis. However, youth who report purchasing cannabis, obtaining it from a non-friend source, or using someone else's medical cannabis are at greater risk of negative outcomes. There's little research looking at what changes to youth cannabis sources occur after adult use legalization. One study in Washington state found that among youth who use cannabis, 18% reported giving someone money to purchase it for them, 11% obtained cannabis from their home with or without parent permission, and 6% reported buying cannabis at a retail store. The perception of a substance's harm is a really important metric to track because there's an association between thinking a substance is less harmful and using it. Nationally, we're seeing a decrease in youth's perceptions of cannabis's harm. Studies have not found that medical cannabis laws were associated with decreased risk perceptions, but it's too early to determine what impact adult use laws have on risk perception. Despite decreased risk perception trends nationally, we have not seen an increase in youth cannabis use that might be expected. And researchers find that this is due in part to decreases in other associated risk factors, such as decreased cigarette smoking. Since adult use policies are so recent, there are many gaps in the research. We cannot yet fully assess the impact of legalization on youth perceptions, use, pattern changes, including complementary and substitution effects, and changes to type and potency of products used. In particular, any changes to the use of highly potent products and consumption methods, such as dabbing, should be monitored. Research with individual level data is needed, and particularly for protective factors among cohorts who may be uniquely affected, such as youth seeking treatment for substance use disorders, youth who work, or youth in the juvenile justice system. Additionally, research on best practices for youth cannabis use prevention and intervention is needed, including assessment of practices currently employed in schools. After assessing the data and literature, we've come to several considerations. We know that risky behaviors tend to be associated with one another, so cannabis prevention should not occur in a silo and should instead be integrated into other evidence-based prevention mechanisms. Education about cannabis use and its effects on youth continues to be critical in mitigating potentially adverse outcomes. So the public awareness campaign could continue with a focus on youth prevention and harm reduction. As research identifies youth at greater risk in the Commonwealth, prevention messages could be targeted to these groups. Education materials must be inclusive, multilingual, and should reach all affected communities. Monitoring youth cannabis use using reliable, systematic data is essential to track change over time. The Commonwealth could work with the healthcare system, including school health systems and researchers, to monitor rates of cannabis use behaviors, disorders, and any acute use clinical presentations. Additionally, the Commission could work with the Department of Education and Secondary Education to assess cannabis use behaviors, including related disciplinary actions in school. There are varying data collection mechanisms implemented across the state already. The Commonwealth could add measures to these surveillance systems to more accurately assess type, method, frequency, and patterns of cannabis use in youth cohorts, as well as changes in social norms and perceptions of harm among youth, pregnant, and breastfeeding women. An example here in regard to current news is that the current surveillance system in Massachusetts does ask about youth vaping, but it does not discern the substance being vaped. So the rates or changes to youth vaping cannabis cannot currently be assessed. Thank you for your time.
Thank you very much. That was fascinating and incredibly informative. Are there questions from commissioners?
Mr. Chairman.
Commissioner Flanagan.
Mr. Chairman, I just want to thank Samantha and Dr. Johnson for their extensive work, not only in assessing the data, but realizing the gaps that we have here in Massachusetts. I think this is an important time to mention that, research development and the data that we need to collect is an interagency endeavor. And I think that DESE and DPH are really important to the Cannabis Control Commission's work, given the fact that they may be in a position to collect more data in different areas. Just as DPH put out their advisory yesterday with regards to vaping and getting a handle on what's going on here in Massachusetts, I think it's going to take some time for us to also realize what is the effect of legalization in Massachusetts and how does it affect youth use, substance use disorder, and the like. And so I think it's important that when we're talking about this, we really grasp the realization that while we're trying to get as much information as we can, there's still some work to be done. So I really appreciate the work that you two have done. As someone who voted on Chapter 55, I know that it was ambitious in the research agenda. I also understand that we may not be able to collect all that data that we need as of yet, but I know that our friends up on Beacon Hill are working on that. So I really appreciate all your work.
Thanks, Commissioner Flanagan. Any other comments or questions? Commissioner Title.
Thank you. As always, very informative presentation. Just one question. So I didn't understand one part. So when you said that the perception of harm is decreasing, we would normally expect that to be associated with increasing use, but it wasn't. And decreasing cigarette smoking rates might explain that. Could you spell that out more?
Yeah, so researchers have tried to figure out what the mechanism is, why it's not increasing, and they found that there's been decreases in other associated risk factors, and one of the biggest ones was a decrease in cigarette use.
Thank you.
Commissioner Doyle?
Sure. Thank you. This is great. And, anything we can do to help facilitate better and accurate data collection let us know, because I'd love to help in any way. I think that's so important. I have a similar question. I just wanted to try and understand a little better. If you go back to slide 20, where it's talking about the logistical regression findings and the 19 risk and 5 protective factors identified, cannabis policies did not moderate effects of risk protective factors on cannabis use outcomes, with the exception of driving after alcohol use. Could we just expand on that a little more?
Yeah, so we first ran all of the factor based on if any of decriminalization, medical, or adult use had any impact on cannabis use behaviors, and then we ran the risk and protector factors separately in their own separate models to see what the association is with all the outcome cannabis use behaviors, and then sensitivity analyses were run to see if, to combine those two, to see if adding the impact of legalization influenced either positively or negatively those other risk factors. The only one that was affected was driving after driving after alcohol use, and it was showing that a moderated, that actually the enactment of these policies were moderating those factors. I think this has less to do, and that's why I didn't want to point this out, it has less to do with cannabis law enactment and more to do that this is actually a secular trend that's decreasing over time. So all substance use behaviors in youth are decreasing over time, and I think this has more to do with that than any enactment policy.
Okay, great.
Yeah.
No, it's really helpful.
Any other questions or comments? Can I just ask, after also sharing my thanks with the other commissioners, what's next up on the research agenda? No rest for the weary, right?
So we have a busy fall ahead. We were lucky to have a fellow this summer who is working on positive impact plans assessment. So she's going to be presenting in October. In November, we have a collaborator at UMass School of Public Health, Dr. Jennifer Whitefill, who is going to be presenting the state of the data and identifying what data sources exist and where are the limitations across the Commonwealth to fulfill our annual mandate. And then in December, we have your industry report.
Right.
So that's next.
Great. That all are incredibly important topics I'm looking forward to hearing about.
Okay.
Thank you very much. I really appreciate it. This is an incredibly important part of our mission, so thank you so much for what you're doing. Okay, can I have my clicker back?
Thank you.
Okay, as I mentioned, we'll go through, I'm going to have to just go through fast because there are a lot of footnotes here. The next item on the agenda, before we get to the executive director reports, is approval of minutes from previous meetings. There are two sets of minutes to be approved. The first is from July 17th, 2019. Can I ask the Commission, have they had a chance to review those minutes, and are there any questions or comments? Then can I have a motion, please, to approve the minutes from July 17th, 2019?
So moved.
Can I have a second, please?
Second.
Let the record show that Commissioner Doyle made the motion to approve, seconded by Commissioner Flanagan. All in favor?
Aye.
Let the record show the Commission unanimously approved the minutes from July 17th, 2019. The next set of minutes are from August 8th, 2019. Can I ask, has the Commission had a chance to review, and are there any questions or comments? Then can I please have a motion to approve the minutes from August 8th, 2019?
So moved.
Can I have a second, please?
Second.
Let the record show that Commissioner Doyle made the motion to approve, seconded by Commissioner Flanagan. All in favor?
Aye.
Let the record show the Commission unanimously approved the minutes from August 8th, 2019. We will now move into the Executive Director's report. Mr. Executive Director, I guess before we get into the data, you have job descriptions you'd like to discuss?
That's correct. Thank you, Mr. Chairman. There's two descriptions for the Commission's consideration. I think I will discuss them as kind of a package, but obviously they're independent and individual descriptions. So as the Commission continues to grow and evolve, we've now added a volume of staff that I think represents really a nice opportunity for us to now consider kind of leveling off and trying to bring some management structure to some pretty good-sized teams, but also allow ultimately for upward mobility for staff as well. So the two positions before you for consideration are that of an investigations manager as well as that of a licensing manager. So under Chief GB, we have the licensing team as well as an investigations and enforcement team. The licensing team is comprised of 3 licensing specialists, a licensing analyst, and Kyle Potvin, our director of licensing. So adding this level of staff will certainly free Kyle up from a policy standpoint, but also allow him to oversee the licensing functions and hopefully not be as intimately involved in day-to-day specific license applications. So again, really an attempt to level this team. Similarly, on the investigation side, Patrick B.A., our director of investigations, oversees and supervises every single investigator as well as compliance officer. And so adding this tier will allow us to really develop additional teams and free him up to manage the logistics, but also less on a day-to-day specific case. So again, I think this, as we grow, I'm going to be looking for opportunities like this to kind of right-size our teams and make sure that we have the appropriate accountability measures in between.
Great, thank you. Any questions before I ask my standard questions about budgeting and whether they're lawyers or not? Then can I ask, are these budgeted positions, Mr. Executive Director?
They are for this current fiscal year.
Yes, great. I guess I'll wait till they show up to ask whether they're lawyers or not. Great. And when would these be posted, Mr. Executive Director?
This is something I think we have a number of positions that are open right now. I'd like to try to focus on getting those positions filled. So I certainly not immediately. I think my objective would really be to kind of clean our plate a bit. And again, I also envision these may have the potential for internal promotions as well.
Yeah. Great. Okay, so can I ask for motion then to approve the job description for licensing manager?
So moved.
Can I have a second, please?
Second.
I'll let the record show Commissioner Flanagan made the motion to approve, seconded by Commissioner Doyle. All in favor?
Aye.
Let the record show the Commission unanimously approve the motion. Can I ask for a motion, please, to approve the job description for investigations manager?
So moved.
Can I have a second, please?
Second.
Let the record show Commissioner Flanagan made the motion to approve, seconded by Commissioner Doyle. All in favor?
Aye.
Let the record show the Commission unanimously approve the motion. Thank you very much. Anything else before we get into your standard slides, Mr. Executive Director?
No.
Go ahead.
So I'll be brief but thorough, or at least an attempt at that. So these are familiar slides as far as the Commission previous presentations. You'll see here there's a total of 348 applications that are currently pending, with all 4 packets having been submitted, and these are therefore awaiting review. Again, the total is 348. You see the majority, or 144, are that of a marijuana retailer, and next would be 104 for cultivation. This next slide indicates kind of a total universe within the licensing portal. There's 3,280 that have less than the 4 packets submitted, so therefore, from a commission standpoint, are incomplete. Again, there's 348 that are pending, 356 have been withdrawn, 4 to date have been denied, and 189 have been considered and approved by the commission. Those 189 that are now in a licensing pathway are, again, the breakdown is 73 retail, 57 cultivation, and 49 product manufacturing as being the predominant.
And so we still have do we know what the status of queue is with respect to research facilities? Are there any completed
There are a
applications?
handful. There are a handful. Yep.
Great, thank you.
Next here, you'll see that there, of the 189, where they break down in our licensing process, you'll see that 1 is provisionally approved. The distinction there is that provisional license, the date of that license actually stems from the date of the license payment. So there's 1 that has not yet paid its license fee. 109 have a provisional license, have secured that. 15 have a final license. And to date, there are 64 entities that have commenced their operations. This next slide represents the breakdown between RMD, economic empowerment, priority applicants, as well as those of general applicants. You'll see there's 537 in total. 211 have secured RMD priority status, 14 have secured economic empowerment priority status. Those 500 plus represent 265 different entities. Next slide indicates the various disadvantaged business enterprise statistics. Again, these are disclosed by the applicant when they do in fact apply. You see the 537 there. The majority, 448, have not identified as a disadvantaged business enterprise. This next slide indicates in our process where various applications are. Again, you'll see that there's 193 that have been considered to date. 188 are awaiting their initial review. 113 have been reopened and therefore require additional information to be submitted. 36 are awaiting a third-party response, and 7 are before you for consideration. This next slide indicates in total each license type where they propose to be located across the Commonwealth. Again, you'll see that by and large, Worcester County has the largest concentration of applications. This next slide indicates those that are retail applications that are pending across the Commonwealth. Again, Worcester County is the predominant. This next slide is a request of Commissioner Doyle, a continued bit of a pizza tracker, which we're also working on based on the change in regulations that have been considered, which really indicate where licensees or each license type, where they are in our total process. So realizing that it's busy, it does try to break down based on type where they are in our process.
Does that meet your request, Mr. Doyle?
Yes, but it's not a new slide.
It's not a new slide, that's correct.
That's correct. Yeah, okay. Thank you.
This next few slides pertain to agents and agent registrations. You'll see that there's currently 5,846 that are active. The staff's workload at this point is really 207 applications. Where those break down is on the right-hand side, which is that 98 need to still be reviewed. 107 have been reopened for additional information. 2 are awaiting a third-party response. And these are considered on a rolling basis, and therefore there are none pending. So next slide, again, sticking with agent registrations, you'll see the majority, 66% identify as male and 33.4% identify as female. Additional race and ethnicity information relative to agents. Again, you'll see that 73.3% identify as white. This next slide is data relative to the medical use of marijuana program. Again, you'll see that there's a total of 159 applications. There's a number pending that are in the application of intent stage at 36, management operations profile stage at 12, and the siting profile at 6. On the right-hand side, you'll see some licensing statistics. You'll see there's 97 provisional, 4 final, 53 have commenced their operations, and 10 have expired. Similarly, relative to the medical use of marijuana program and the agents, you'll see there's a total of 4,782 active agents. Also on the right-hand side, there's data relative to certified patients. There's 60,917 certified active patients, as well as 315 registered clinicians.
Thank you. You did go through that quickly, but I think thoroughly. Are there any questions?
One question.
Commissioner Tuttle?
Thank you. Could I request that at the end of the year, for the demographics, that we have line graphs so we can see how it's changed since we started tracking?
You can absolutely request it. I will now.
Hey, don't get cocky. Just because I said nice things about you, don't get cocky.
I will strive to provide that. Yes.
Thank you.
I will. If unable to, I will certainly let you know. But I think we can do that. I have no doubt we can do that.
Thank you.
Any other questions or comments? Great. Okay, then the last agenda item for the day is an enforcement action with respect to MCR Laboratories, license number IL 281278, Independent Testing Lab. Mr. Executive Director, would you?
Yeah.
Are you ready, Mr. Executive Director, or do you have some more graphs to draw before we move on to the next topic?
I'm learning the art of doodling. I will figure this out. Actually, I'm happy to defer to our enforcement staff on this matter.
Who would you like to lead the conversation? Mr. Pear?
Enforcement Counsel Payer, I believe.
Thank you. Mr. Pear?
Thank you, Chair, and thank you, Executive Director. Before the Commission is a proposed final order and stipulated agreement between the Commission and MCR Labs. Based on a full review of evidence in this matter, enforcement has determined that MCR violated the Commission's regulations pertaining to the storage, disposal, and documentation of marijuana waste when it disposed of marijuana mixed with liquid methanol in an unsecured solid waste dumpster located on the laboratory's exterior premises, and failed to document the location, manner, and witnessing of disposal of marijuana samples tracked in its laboratory inventory management system. In resolution of this matter on July 18th and 24th of this year, enforcement held a dispute resolution conference with the licensee and reached a tentative proposed agreement to pay a monetary fine in the amount of $225,000 in connection with resolution of the violations and subject to the payment schedule set forth in paragraph 16B of the proposed agreement before the Commission. Enforcement recommends Commission approval of the proposed final order and stipulated agreement because the licensee has submitted responsibility for the violations set forth in the order, fully cooperated in the Commission's investigations and requests for information, and has taken sufficient corrective steps to remedy the violation.
Thank you very much. Are there questions for the enforcement staff or Commissioner McBride?
First, I want to commend licensing and enforcement for their execution of this agreement. I am very impressed by the manner in which you've been going about reaching these agreements, and I appreciate it. I know it takes a lot of work, and your diligence is certainly noted. I had a question about the summary of proceedings. So here it says on April 8th, 2019, the Commission, acting through its investigators, conducted a reinspection of the respondent's facility and determined the plan of correction had been substantially implemented. But then it says on June 26th, 2019, the Commission notified the respondent of its intent to seek issuance of an order to show cause. Can you talk a little bit about those two provisions and sort of how they mesh?
Absolutely, Commissioner. As you had stated, after the reinspection, and it should be noted, a continual monitoring of the laboratory, because the concern with these particular violations are both the substance of what's immediately before us when we look at them, but also the fact that these are violations that go to the core of a independent testing laboratory's responsibilities. And based on those violations at an early stage in the Commission's regulatory activity, it was deemed important to monitor continued compliance. The letter of enforcement intent that was sent to the licensee in July of this year set forth the enforcement team's intent to make a recommendation to pursue in order for show cause to take a suspension action or imposition of monetary fines, and also set forth the opportunity to engage in a informal voluntary dispute resolution conference to explore whether the parties could reach an agreement to propose to the Commission that would be sufficient to address the Commission's concerns consistent with its enforcement authority.
So am I correct in saying, in other words, that this was not sort of like a one and done? We didn't kind of find like one issue and then, kind of went. So, I mean, I think that this has been in the air for a while, right? That we've been trying, the licensing and enforcement staff has been kind of, working their way through this process on this particular licensee. And this was a substantial undertaking. It wasn't just kind of one issue that we were dealing with, but there were a couple of strands that we kind of had to pull at. Is that accurate?
That is accurate.
Are there other questions, comments? Commissioner McBride?
Nope, I'm good. I just wanted clarification
Okay,
on that
no,
one
that's
issue.
fine. Then I would like to ask for a motion to approve the settlement proposed by our enforcement staff.
So moved.
I'm sorry, that was Commissioner Doyle or Commissioner McBride? Let the record show Commissioner McBride made the motion to approve, seconded by Commissioner Flanagan. All in favor?
Aye.
Let the record show the Commission as we approve the motion. I want to extend my thanks to the enforcement team, not just for the hard work behind this investigation, but the way it was resolved. My objective, and I hope it's all of our objectives for enforcement, is it's not punitive. It is about making sure that our regulations are complied to going forward, and I think you've done a great job in doing that, so my thanks to you. We are not going to adjourn because we're still in the middle of the agenda for the same meeting that we had today. So we will meet again at 10 o'clock tomorrow morning in the same location.